Hi, everyone, and welcome back to the Non-Traditional Nurse. Today, I am so excited to introduce Dr. Molly McClelland. Thank you so much for joining us today, Molly.
Thanks for having me.
And she is a dedicated nursing professor at the University of Detroit Mercy, who also happened to be one of my own professors during nursing school. So I'm so excited to have her today. So we're going to dive into her journey from bedside nursing to education and talk about some insights on how she prepares the next generation of nurses and any advice for those considering a career in teaching in the future. So let's get started. So,
Okay.
Molly, can you start by talking just a little bit about your nursing journey and what inspired you to transition ultimately into the field of nursing education?
So I obtained a Bachelor of Science in 1988 and started working at the bedside in intensive care units. I got my bachelor's degree out of state. I came back to Michigan and started working at University of Michigan in the ICUs, but all of my close nursing girlfriends were in different states. I have a twin sister. She got married, moved out of state, and I had been working in the ICU for a couple of years, and I was just a little, I don't want to say bored. I was just looking for something else to do. And I knew eventually that I wanted to get a master's degree. I wasn't entirely sure what I wanted to get a master's degree in, but I sort of had this lull. And that's when I decided to go back to nursing school to get a master's degree. When I took the GREs to get into graduate school, one of my professors looked at my scores and said, "Oh, had you ever thought about getting your PhD?" And I thought, no, not really, because I just hadn't. I loved my research and stats courses in undergrad, but I never thought about pursuing that as my career. But that one professor that said, "Had you ever thought about going for your PhD?" This little thing in the back of my head just kept saying, well, I like research. I like, finding out evidence. And so that's how I started pursuing a PhD. So I started working on my master's degree and my PhD kind of at the same time. So that's really what got me from the bedside into education.
Awesome. And you've taught a wide variety of classes throughout your career, undergraduate, graduate, some interdisciplinary. Can you give us an overview of kind of the different courses you've had the opportunity to lead?
Yeah. So my clinical background is all adult health. Like I mentioned, I worked in the neurointensive care unit. I set up a gastrointestinal multidisciplinary cancer clinic when I was at U of M. That became pivotal because I started developing multidisciplinary experience in that clinical setting. And then when I decided to go into academia, it was just a natural fit to start teaching medical surgical nursing. That's my forte. I've always only done adult health. I've never done any other kind of nursing. I love adult health. I'm still doing adult health. And so when I started teaching at University of Detroit Mercy, I was assigned to a medical surgical course. I was teaching juniors and I loved it. I loved teaching med surg to undergraduate students. At the same time, I was also a clinical nurse specialist. That's what I did when I ran that gastrointestinal multidisciplinary clinic. I did that as a CNS. And so that was also a natural fit for me to start teaching at the graduate level in the clinical nurse specialist courses. Also at the same time, as a junior faculty, one of my engineering colleagues was setting up a course where he was assigned to teach the capstone course for the mechanical engineering students. And he just had a heart for people. He didn't want to just do something else in automotive. We're from Detroit. Everybody does automotive here. He really wanted to do something that fit with the mission of UDM, and to be reaching out to people. But he didn't have any people skills or experience. So he reached out to the College of Health Professions and said, "Hey, this is my idea. This is what I want to do. Does somebody want to help me?" I was probably biting off more than I can chew as a new faculty, but it sounded interesting. I raised my hand. I said, I would love to do that. And so that's how I started teaching the multidisciplinary nurse engineering course, where we build assistive devices for people who have physical disabilities. And we pair up with a person from the community who has a physical disability. And then we have nursing students and engineering students work together to design a device. And it can't be something you can buy on Amazon. They have to be creative and innovative and collaborative. And it's a 2-semester course where they come up with an idea of what to build. And then by the end of that academic year, they're actually building that device. And the nursing role on that is to make sure, one, to educate the team on what is the disability the person has. It could be spinal cord injury, MS, CP, any physical disability. And then as the device is being developed, is it medically safe? And, what could be some potential risks that maybe the engineering students don't think about? Like, if we're developing a cushion, could it cause decubitus ulcers? Could it cause impair their pulmonary status? So those are the 3 courses that I have been teaching: is undergrad med surg, clinical nurse specialist, and then this nurse engineering courses. So those are the 3 that I've been teaching for the last 17 years now.
Yeah. And that nurse engineering course just sounds so impactful and really getting nurses, thinking about how to solve problems in a way that you don't typically learn in your standard courses. So
Yeah.
I really love that. And I know you touched on this a little bit, but how has your experience as a nurse at the bedside or as a CNS really shaped and influenced your approach to teaching?
I think being a bedside nurse, I think every single nurse needs to start out at the bedside. You need to have empathy for the patients, empathy for their family. You really hone those assessment and intervention and evaluation skills that are so very, very important for every single nurse, whatever you're working, whether it's at the bedside or it's non-traditional. That's what makes a nurse is, can you assess, and can you assess quickly and accurately, and what are your interventions, and are your interventions appropriate? And having that experience both at the bedside and as a clinical nurse specialist, that gave me it gave me an awful lot of examples that I could use with my students. And I'm currently also working as a clinical nurse specialist twice a week in an outpatient setting, running a care management program, which I think is really important as an educator. If you're a nurse educator, I really believe it's helpful to keep at least a little bit of a foot in that clinical door so that you're relevant for your students. Because if you're trying to teach students who are actually taking care of patients in whatever role that looks like, including education, if you haven't seen a patient or haven't been in a healthcare system or haven't collaborated with other healthcare providers in a long time, you're going to be a little less relevant to your students. So I think having those experiences and continuing to have those experiences like I do now in the outpatient setting, I think that makes me relevant and gives me a little more credibility when I'm talking to my students about, hey, this is how to be a clinical nurse specialist. This is how to function, as a bedside, because I'm actually doing it. It's not something that was 30 years of my history.
Yeah, and healthcare changes so fast
so fast.
Yeah, to keep up
Yeah.
with everything, you do have to have a foot in the door. And it's great to see that there is that flexibility as an educator too, to be able to have something on the side where you can stay relevant and keep your skills sharp and everything.
They do like that in academia, in any of the practice professions. And Detroit Mercy is fabulous with this, where many of our professors are actually in the professional world as well, not full time usually because we're full-time professors, but just enough to stay relevant. And I think that's a benefit for our students at Detroit Mercy.
Yeah, absolutely. And throughout your career as an educator, what have you found to really be some of the most rewarding aspects of working with nursing students and really shaping the future of healthcare professionals? You do have a big part in that.
My favorite part of teaching students is that aha moment. I love, and this is especially pertinent at the undergraduate level, because at the undergraduate level, these are not nurses already. My clinical nurse specialist students, they're already nurses. So I'm teaching them things like, how to prescribe medications, how to do an advanced assessment, how to improve at the system level, at the quality level. And those are fun and very rewarding. But my favorite is when I had those undergraduate students, and I don't teach med surg anymore to the undergrads, and I miss it. But those, like, oh, I get it, and oh, that makes sense, and that was my favorite, when I was able to impart information to students and have it click, because I knew if you can understand the why of what you're doing, then you're much more likely to do it and do it well and do it like you're supposed to, rather than if we just have you memorize stuff, everybody, you'll forget it. But if you can teach students the why we're doing something, and then they're like, oh, I get it. That's my favorite. That's what I
Yeah, I
loved.
remember having those moments. And I think, you have such a unique place. You talk about, somebody kind of being that voice to say you're really talented at that. That's probably something you get to see with students too, and be that voice for them to point out, this is such a strength of yours. Like, I'm so impressed by this. And it probably makes a huge difference in their career trajectory, really.
I'm a huge fan as an educator to identify exactly what you just said. Identify, what are the things that somebody's really good at, and then trying to direct them in those fields. Because you can see, as nursing students come up, you can tell what somebody's skill sets are and what their passions are. And if you can identify what somebody's passions are within healthcare and direct them in that field, now you've just created an expert in that area with a passion for what they're doing. And then they're going to be really, really good at that. And that's always been one of my favorite things in
Yeah,
education.
and they'll love it. And that's the biggest part
Mm-hmm.
of it all.
Right.
So, when we talk about aspiring nurses and those looking to advance their career, maybe beyond the bedside, what do you think are some of the most essential qualities or skills they should really focus on developing?
Number one kind of goes back to what we were just talking about. Figure out what your passion is. So as you're at the bedside, and this is the beauty of nursing. So let's say you get out of nursing school and you land a med surg job, and it's you don't love it. You don't love going to work. You start dreading to go to work. Okay, great. Try something else. Go into peds, go into OB, go into mental health. That's the beauty of nursing, is there's so many different areas. Find your niche. When you are a new nurse, find your niche, find your passion. What sparks your interest? Once you found that, then don't just go back to school to get an advanced degree just to have an advanced degree. Figure it out, because there's so many things you can do with a graduate degree. If you want to practice, then look at the advanced practice registered nurses, the APRNs. There's 4 of them: nurse practitioner, clinical nurse specialist, nurse midwife, and CRNA, certified registered nurse anesthetist. Figure out what you want to do. If you love to administer anesthesia, if you love the operating room, if you love just in and out with your patients and you don't have a long-term relationship, maybe look into CRNA. If you only want to assess and treat patients, maybe nurse practitioner is you. If you love babies, be a certified nurse midwife. If you love to prescribe, assess, improve quality at the system level, do a little bit of education with patient education, nurse education, be a CNS. That is the clinical nurse specialist role, encompasses all of that, which I think is the best of the APRN roles, because you get to do a little bit of everything. But figure it out. If you don't want to go into practice, if you want to go into leadership, maybe go into I didn't mean leadership, I meant administration. Maybe go get like a healthcare administration degree or an MBA. So figure out what makes you tick. If you like numbers and budgets, and be a nurse manager. I used to think I wanted to do that. I'm like, oh, absolutely not. That's not what I wanted to do. And but if you figure out what you want to do, pursue that avenue. If you love quality improvement projects, go get a DNP because they do quality improvement. If you want to do research and evidence based, go get a PhD, and then you can start teaching at the academic level and doing research. That's phenomenal. We need way more people in nursing doing evidence based research. So before you just launch into more degrees, make sure you're doing the right degrees and and following the right path that is going to be best for your passions and your careers.
Absolutely. I think narrowing your focus, the beauty of nursing, like you said, is you can do anything. But narrowing your focus can give you some direction in what that looks like and an end goal and everything like that. I think it's much more digestible that way.
Yeah,
But
for
that's
sure.
really where the non-traditional nurse was born, is just showing, how many amazing paths there are. We work so hard on our nursing career, so let's find the perfect fit.
And there's a need for nurses everywhere. Everywhere they need nurses in all over, like in industry and insurance and
Mm-hmm.
in school systems, and every place needs nurses. So if there's a need for nurses, like I said, I'm in an outpatient clinic now and running a care management program, and it's fantastic. So yeah, let's get more nurses in more places. Improving health is my goal.
Absolutely.
Mm-hmm.
And then specifically when we're thinking about a nurse who might be thinking in the future, nursing education, teaching, what advice would you give them, if they're at the bedside now? Where does that start? Where does it look like?
Again, ask yourself, what's your ultimate goal? If you want to be a nurse educator within the healthcare system, then you can probably just go get a nurse education certificate. And that will then qualify you to be that nurse that's inside the healthcare system that's teaching, your yearly competencies and things like that. If you want to go beyond that, if you want to start teaching at the community colleges, you can go get a master's degree. And you can get a master's degree in one of the APRN roles. It would be helpful to also get a certificate in education, because there are some nuances to teaching that you don't get in your undergraduate, like all the things that you need to do as a professor, developing syllabi, developing curriculum, developing like how to do a PowerPoint. You're not going to get that in your BSN courses. But if you want to do that at a community level, you can do that with a master's degree. If you want to teach at the university level, you really, at some of the smaller universities, you can have a DNP, a Doctor of Nursing Practice. They focus on quality improvement projects. Most of the bigger universities, in this area, well, I won't name them, but the big state universities, they really like their professors to have PhDs, because they also require their professors to have a line of active research going on. And some DMPs do lines of research, but they're really more focused on quality, whereas the PhDs are focused on, evidence-based kinds of research projects. So not every university, like UDM, we have both DMPs and PhD doctorate level professors, but that gets a little harder if you want to move up into some of those more what we call research focused universities. Then you really need to have that PhD. So again, ask yourself, what's your ultimate goal? And if it's teaching at the big universities, you should probably get a PhD.
Yeah, I think it's so valuable just narrowing your focus, finding what you want to get out of a degree before pursuing it, because there's so many different avenues to take. So
Right.
Well,
Yes.
Molly, thank you so much for sharing your journey with us. You're having an impact on the future of healthcare practitioners, and it's awesome to hear your insights firsthand. So, for anyone interested in exploring non traditional nursing careers like education, make sure to subscribe to our monthly newsletter for more interviews and career insights. And thanks again, Molly.
You're welcome. And I'm happy to take any questions if anybody ever wants to reach out.
Amazing. And thanks for tuning in. We'll see everybody next time.
Thanks, Ellie.